As the Delta variant continues to spread, more communities are becoming higher risk areas.
Joining us to talk about the latest numbers and more is internal medicine specialist, Dr. Abha. Good morning, doctor. Thanks for coming back.
Rob and Bruda, thank you both for having me.
We've been mentioning this morning that officials seem to be alarmed at the rise in recent cases. Why are they alarmed?
That's an excellent question, and thank you for having me this morning. I'm going to draw on some historical perspective. In 1964, the Surgeon General of the United States came forward with data telling us that smoking was injurious to the health of smokers. And within a year, tobacco companies were required to put labels on every single tobacco product. What would then ensue is the banning of ads promoting smoking on forward. Within a decade, the Surgeon General came back and said, not merely is smoking injurious to the health of the smoker, but to the bystanders around them, such that waitresses, waiters, children in schools, anybody in secondhand distance or passive exposure to the smoke could go on to develop things like lung cancer. And so by 1991, tobacco was listed as a grade A carcinogen. And since that time, over 30 states have mandated that indoor use of smoking be banned, because we understood that not merely is it injurious to the health of the individual choosing to smoke, but those around them. Today, we have a global pandemic where 200 million people around the world have been infected, 4 million are dead, and here in the United States, 1 in 10 Americans has contracted the infection. 620,000 Americans have passed. The Delta variant is highly infectious. We have not overcome this virus. And in fact, it has mutated to a variant whereby the R infectivity or the R naught has gone from 2 individuals that you can infect to 5, 6, 7, or 8. The CDC, the American Academy of Pediatrics, and the Michigan Department of Health and Human Services has listed Kent County as being in substantial risk category. That means that it is highly recommended to mandated that indoor spaces require masking. And I'm going to elaborate why. There are certain measures that were taken during the smoking conversation that we understood to be safe for those around potential smokers. Same goes for the COVID virus transmission. If you are in close proximity to someone with the infection, if you spend longer time indoors with them, in spaces where ventilation may be compromised, the rate of infectivity will rise such that one person bringing the infection into a poorly ventilated space can go on to infect scores of people. It is a very concerning time. Delta is not like the wild type, where the R naught infectivity was 2 or 3. It is now 5, 6, 7, 8, or more. Time is pressing. Kent County has a substantial risk categorization, and at no time like the present to contain this highly infectious variant.
And Dr. Abha, we can see just how passionate you are getting this information out there. Just really quickly, how does it make you feel to see, the issue of masking and getting vaccinated be so polarized?
I'm a parent and a doctor. I find it fascinating that patients have to mask in my presence in the office system, and that there are certain protections that are afforded me as a physician, but those same protections will not be afforded scores of children in the same manner. Why is it that buses and trains and airports and airlines and hospital systems mandate masks, but other institutions, to include schools, do not? When that same rate of infectivity, the same concerns for spread, the same concerns pertaining to ventilation, and hours upon hours spent with a potentially infected individual still exist in school systems, we must rely on science and data. If the American Academy of Pediatrics and the CDC and the Michigan Department of Health and Human Services is enjoining the public to simply wear a mask to protect one another, I guess I question why it is that our own health department superintendents and those with the power to make life-saving decisions cannot follow suit, much as the EPA, the Surgeon General, made life-saving decisions concerning smoking decades ago.
Very good analogy there. Dr. Abha, thank you so much as always for being here and providing us with the information.
It's always a pleasure. Thank you for having me.